Hello and welcome to our exploration of a vital component of human health, vitamin D. Often misunderstood and underappreciated, this nutrient plays a central role not only in maintaining bone health, but also in supporting our immune system, mental well-being, and much more. Vitamin D, a fat-soluble vitamin, is essential for the absorption of calcium and phosphorus in our intestines, which are crucial for maintaining strong bones and teeth. A deficiency in vitamin D can lead to weakened bones, increased fragility, and a higher risk of fractures. In children, this can result in conditions like rickets, while adults might face osteomalacia and contribute to osteoporosis. Beyond bone health, vitamin D is integral to other bodily functions. Immune cells possess specific receptors for vitamin D, indicating its direct role in immune regulation. It not only helps reduce chronic inflammation, but also supports cardiovascular health, hormonal balance, and may lower the risk of certain chronic diseases. Now let's delve into the differences between the two main forms of vitamin D. D2 and D3. While both are used to elevate vitamin D levels in the blood, they are not identical in their biological effectiveness or stability. Vitamin D3, or cholecalciferol, is naturally produced by the human body when the skin is exposed to ultraviolet B rays from sunlight. It is efficiently converted by the liver and kidneys into the active hormone that our body relies on. In contrast, vitamin D2, ergocalciferol, is typically derived from plant sources and certain fungi exposed to ultraviolet light. Though it can raise vitamin D levels, it's often less stable and effective than D3. Why does D3 perform better? Research indicates D3 is more effective at increasing and maintaining adequate vitamin D levels in the bloodstream. After supplementation, D3 remains active longer, whereas D2 is broken down and eliminated more quickly. Notably, some studies suggest that D2 supplementation may lead to a reduction in natural D3 levels, raising concerns about its long-term use. The immune system particularly benefits from vitamin D3. It doesn't just boost immune activity. It regulates it, ensuring responses are effective yet not excessive. This balance is crucial in preventing chronic inflammation and autoimmune disorders. Vitamin D3 supports innate immunity, the body's first line of defense against bacteria and viruses, by promoting antimicrobial peptides that inhibit harmful microorganisms. In contrast, D2 does not exert the same level of support. Mental and muscular health also align with vitamin D3's benefits. There's growing evidence linking vitamin D deficiency to mood disorders, such as depression and seasonal affective disorder, especially in regions with prolonged winters. Vitamin D3 influences neurotransmitter regulation in the brain, notably serotonin, which is vital for mood stability and emotional well-being. It also contributes to muscle strength, coordination, and balance, reducing the risk of falls in older adults. When should we consider vitamin D supplements? Ideally, the body can produce sufficient vitamin D3 through sunlight exposure. However, modern lifestyles often hinder this natural process. Indoor work environments, protective clothing, sunscreen, and geographical factors contribute to widespread deficiency. Consequently, dietary supplementation becomes necessary, particularly in autumn and winter. Most medical guidelines recommend vitamin D3 for its superior effectiveness and safety. As plant-based diets gain popularity, the demand for non-animal sources of vitamin D3 has increased. Recently, plant-based D3 derived from lichen offers an effective alternative for those avoiding animal products, maintaining the same biological efficacy as traditional sources. Despite our advances, many questions about vitamin D remain. Optimal dosage levels, individual differences in absorption and metabolism, and interactions with other nutrients need further research. More long-term studies are necessary to fully clarify the functional differences between D2 and D3. Expanded research will lead to more precise guidelines and help identify which populations benefit most from specific supplementation forms. In conclusion, current evidence highlights vitamin D3 as the most effective and reliable option for maintaining adequate vitamin D levels, benefiting immune health, bone strength, muscle function, and mental well-being. Meanwhile, D2 appears less effective and might even reduce natural D3 levels in some cases. Therefore, choosing supplements wisely and prioritizing D3 is advisable. consulting healthcare professionals to determine appropriate dosage based on individual needs remains essential. An informed approach to vitamin D supplementation can significantly contribute to long-term health.